So again, preventing, into prevention part of things, prevent and management of hypertension. Dr. Morrison, of course, will talk more about the DASH diet and the dietary approach to stop hypertension, which is highly recommended diet. We'll also talk about, of course, the consistent, healthy lifestyle habits. And I'm sure Dr. Gavin, my son Justin, along with Dr. Morrison, will talk about those things as well. Limiting, well, salt, of course, is one of the main culprits. Diets that are high in potassium seem to be much healthier for you, and it gives you a bit of lowering your blood pressure somewhat, as I understand through literature today. Grains, nuts, and vegetables. Again, that's Dr. Morrison's thing. I'm not going to get in her area. Stay in my lane if I can. Limiting alcohol, managing stress, and getting enough sleep. Hey, I should be the person that managing getting enough sleep. I get about 4 or 5 hours a day if I'm lucky, right? So it is what it is. Next slide, please. So again, Justin will be going over the activities, regular activities, physical activities for chronic disease. And I just told him specifically, look at chronic disease, which we went over that yesterday, last night, late. So he's on top of that. Maintaining a healthy weight, quit smoking. Next slide, please. Okay. Early recognition of a heart attack. Obviously, if you have chest pain, difficulty breathing, you get tightness across your chest, you just don't feel comfortable, maybe a sweat, whatever that is, that could be one of the very early signs of having a heart attack. And as I always say, heart attacks time is muscle. It means you get to the emergency department ASAP, call 911. Stroke symptoms, we've gone over that a number of times, but if you're new to our webinars, stroke symptoms such as not being able to talk properly, slurring of the speech, maybe you have a little bit of weakness in one side of your extremities as opposed to the other side, visual changes, headache sometimes, a little nausea, those kind of things, and passing out. Those can be early signs of a stroke. What you want to do, since you didn't prevent it, you need to get to the hospital ASAP. For a stroke, time is brain. You have officially up to 3 hours to 3.5 hours after the onset of a stroke to get to the emergency department, call 911. Because during that period of time, we're able to reverse that by giving you what is called a thrombolytic, TPA is called, and we push it into your blood vessels and it just cleans that clot out. But it has to be done within 3 to 3.5 hours after the onset of symptoms. Now, when you get to the ER, now when you decide to come, if you have symptoms that start at 12 midnight, we expect you to be at the hospital right around 1, 2 o'clock in the morning. Not that next morning around 10 o'clock in the morning, because at that point, it's too late, right? But again, when in doubt, call 911. Next slide, please. Okay, now this was a slide I want to come in increments, right? Because I want you guys to see me. Yeah, that's me. The wife probably hate to see this on the screen. I'm gonna take a picture just so I can tease her about it, because this is me, guys. That's when I was 268 pounds. And here I am. I had the audacity to have a sucker in my mouth watching TV. Okay. Went to Puerto Vallarta, Mexico, and there was a friend of ours. She took a picture of me before and after. That's where I side by side. The middle picture is. And then I got to tell you guys, when you guys start feeling good, looking great, what you're gonna do next? Well, you gotta get some new clothes. But I got to tell you, your self-esteem, your self-worth goes through the roof. And for me, I'm a cosmetic surgeon. I do like a lot of body sculpting, liposuction. Imagine me, and that's only 4 years ago, guys. Picture off to the left, the guy that has his belly up. Usually when you lay back, the belly would kind of like flatten down a little bit. But for Doc, no. It stayed out there. So I was a pretty big fella. But I want you to look at the scales today. This morning at around, I want to say 9 o'clock this morning, 200.2 pounds. That's my lowest yet. But it's been a journey. Like I said, this is not a sprint. This is a marathon. I started this 4.5 years ago. Manjaro, been on there continuously, once a week for the last 4.5 years. When I decreased my carbohydrates, it even drops a little better for me, right? So the carbohydrates is something that's very important that you make sure with your GLP-1s that you're making that work as well. But again, I just want to give you guys just an idea of how I used to look. And imagine bending over to try to tie my shoes. Very problematic. Got short of breath because again, everything pushes up. We call that cardiac fat. I probably would have been a 2 or 3-year-old ghost by now had I to make some changes. So changes are critical for us to make. Okay, critical for us to make. But don't forget again, obesity kills. It can be done, but it's a marathon, not a sprint. I've done the sprint deal before. Got down to, may have lost 72 pounds. Did it in a period of like 4.5 months. Okay, I'm taking in a little bit less than 600 calories a day. I just forced myself to do it. But I gained all that back and then some. So this is the only thing I can tell you that I've done so far. But you have to stick with it. It's a stick witness thing. You have to stick with the program for what you're doing. Next slide, please. I think that's it for me. Okay, Dr. Gavin, you all know Dr. James Gavin. He's a very good friend of mine. Now we had a chance to visit his compound over there in Arvida, Florida. I got to tell you, the guy reminds me of a younger man. He has blue jeans on. He's out there doing all kind of things as we pulled up to meet Dr. Gavin. Very, very impressive man. So Dr. Gavin, we're so happy to have you as usual. This is your show at this point and you'll just take it away.
Thank you very much.
Oh,
and of course we have Dr. Demetrice Morrison, who is going to also be in the flow of this discussion because we're going to be doing multiple stages. I will kick it off. Dr. Morrison will follow, and then Justin will follow, because we're going to be talking about the different components of what it takes in terms of behavior when you have chronic diseases to get safely and healthily through the holidays. So let me just explain and put in perspective what our goal is today. What we're really trying to do today can best be viewed as helpful hints to get you through these holidays. Because when you have a chronic disease, you're at high risk for some significant setbacks at certain times. And certain times that we are most concerned about are especially during the holidays. And we're going to try to highlight why that is and what can be done about it. We're going to do some background to get used to understand why it is we think the way we do and why we're making some of the recommendations that we're making about how you navigate during the holidays when it comes to the actions that you take with your nutrition, the actions that you take with your physical activity, the actions that you take when it comes to what you put in your glass and hold up to your mouth. All of these things we're going to try to put in perspective for you so you can get safely through these holidays. So let me have the next slide. So there's some common misperceptions that can cause big problems with chronic disease management. I don't care what your chronic disease is, but during the holidays, you can have some big problems if you're not careful. Because one thing, your mind may take a holiday, but the conditions that you have, they don't. They don't care that you are taking holiday in your head. The factors that have the biggest effects on chronic disease outcomes actually can be exaggerated during the holidays. For example, during the holidays is when you have the problem of having too much of the wrong kinds of food, too much of the wrong kinds of drink, too little restful sleep, more stress than you really need to have in your life when you're trying to deal with a chronic disease. Your routines and your schedules can be disrupted and harder to keep. And this is not a casual thing, because a lot of people forget their medication schedules during the holidays. And then we'll get back to this last point. Healthcare access may be harder to get. You just heard Dr. Reynolds talk about if certain things go really wrong, like you start getting signs and symptoms of a heart attack or stroke or some other acute problem, you know what? You shouldn't necessarily count on the fact that the healthcare response is going to be as quick during holidays as it normally is during non-holidays, because it may not. Next slide. Next. Or should I? I'm not controlling, so somebody.
That should be fair controlling this.
Sharing is not turned on, so. Okay, so let's get to some basic principles. And from time to time, we're gonna introduce you to some basic principles because we really want you to be comfortable in your knowledge about chronic diseases and why we talk the way we do about them. For example, everybody thinks that chronic diseases like diabetes, like hypertension, arthritis, has a lot to do with genes. Well, we're talking about your biological genes, okay? But what I want to make the case for is that yes, your genes and your genetic risks are important, but it is your behavior and your living environments that really have probably the most to do with how your diseases will manifest. Let's talk about that a little bit more. The holidays present a whole lot of opportunities for departures from your routine. And there are more of these periods and more of these opportunities for departure than you realize. Even when your doctors and your healthcare providers take vacations, like during these holidays, the diseases that they're helping you to manage don't. Just because your mind and the calendar says that it's holiday time doesn't mean that your body is going to cooperate. Next. Now, I'm going to give you two stories, and these two stories are designed to help you understand how it is we understand the balance between the contributions of genes to a particular disease and the contribution of environment and how people live. Story number one. The Pima Indians who live out in southern Arizona and northern Mexico have been present in that area for centuries. They used to farm that land. They got water from the Gila River. When white settlers started coming into southern Arizona, they dammed up the river. So the Indians lost access to that river, so they couldn't farm anymore. And so what happened? Well, they formed a reservation. So the Indians now had to start living on a reservation. Now, the first case of diabetes ever recorded among those Pima Indians was in 1908. 30 years later, 21 cases had been recorded. But things changed when that reservation started. The reservation meant that they were no longer farming. They were no longer growing grain and corn and vegetables and fishing in the river. They were now eating government commodities, lard and flour and things that they normally never would eat, making fry bread. Their diets totally changed. Their physical activity totally changed. By the 1950s, there was a tenfold increase in diabetes, a tenfold increase. The prevalence of diabetes by the 1970s among these Pimas had gone up to 1 out of every 2 persons. Now, some of the Pimas in that area decided they weren't going to live on that reservation. They decided they would leave southern Arizona, go over to northern Mexico into the mountains, and they started farming again. Now, the difference is this. Within 40 years, those Pimas who left the reservation and went to the mountains and were still farming and having a lot of physical activity, eating like they had always done in their ancient periods, they had 8-fold less diabetes than the Pimas who stayed in Arizona on the reservation. Now, my question to you is this. How much change do you think occurs in genes in 50 years? In your biological genes, you're not going to see changes in 50 years. You may see changes in your blue genes because of changes in your diet and your behavior, but your biological genes are not going to account for an 8-fold less prevalence of diabetes than in the people who share your genetic background. So this is really a matter of where and how you live. You might have a genetic risk, but we say it like this: your genetic risk may load the gun, but it's how you live and behave that pulls the trigger on whether you're going to have the disease. Story number 2 is actually closer to home. Next slide. Back in the day, there was a cohort, a group of people who graduated from Meharry Medical College. And you know, Meharry in Nashville, Tennessee was predominantly an all-Black medical school, okay? And a group of graduates from Meharry were compared with a group of graduates from Johns Hopkins Medical School, all white physicians. And they were followed for 25 years to see how differently did things turn out for them. Well, at the end of that 25 years, the Black doctors compared to the white doctors from Hopkins had an earlier onset of cardiovascular disease. They had higher rates of diabetes and high blood pressure, twice as high. They had 40% higher rates of coronary artery disease leading to heart attacks. And whenever they did have cardiovascular problems, their death rates, 52% versus 9%. So what was the difference here? Both of these groups had gone to medical school. The poverty wasn't their problem, but the doctors back in the days, and remember this is 1950s, the doctors lived in Black communities. They had lifestyles that were characterized by poor dietary habits. Smoking was very popular back then, and they did not have regular physical activity. This had nothing to do with their genes. This had to do with choices and behaviors. Next slide. So what we're trying to point out here is that the balance in terms of what causes a chronic disease to behave badly and to have bad outcomes, more mortality, more complications, the balance is really not in your biology. It's not in your genes. That certainly has something to do with it, but the choices that you make, the environment that you live in, and the behaviors that you follow really are the major drivers of what the outcomes are going to be. That's why we talk about helpful hints of what it is that can be done to make it possible for a person suffering from a chronic disease not to have difficult and bad outcomes. Next one. Now, the major issues in let's take diabetes, as you know, that's my flagship disease. The major issues in diabetes that are affected by holidays, okay? Your routines get disrupted. Meal times, and Dr. Morrison will talk a little bit more about this, can be especially affected. And opportunities for physical activity can be reduced. And Justin will talk a bit more about this. Sleep patterns can be disrupted, okay? Stressful situations, and we're talking about all kinds of stress. Talking about family that you don't particularly want in your house, not necessarily that, but you're talking about things that can happen during the holidays that present stress for you that normally you wouldn't see ordinarily. People who expect presents that they don't deserve. Okay, your routines for administration of medications and monitoring, blood sugar monitoring, blood pressure monitoring. And even though they're not being monitored, the tendency is for things like your blood sugar, your cholesterol level, your triglyceride levels, your blood pressures, and all of the other things that are important in your metabolic health, those things tend to go up. Very often, we don't do the kind of planning that we need to do for the changes that are going to occur during the holiday. I'm going to ask every last one of you, did you talk at all with your healthcare provider about what adjustments do I need to be careful about during the holidays? Is there anybody that had that conversation with your doctor, your nurse, your pharmacist, anybody? Is your diabetes on vacation? Or is it just your mind and your attitude? Is it possible to have a healthy and happy holiday with diabetes? Very important question. Next one. Let's be clear. For cardiovascular and renal, we're talking about kidney, and metabolic diseases, we're talking about diseases like heart disease and high blood pressure and inflammatory diseases. It's much less about the genes and much more about our actions. And so our focus in talking with you is to focus on the things that you can control. We can't change our genes. We can change the blue genes. Now we know that, okay? But we cannot change our biological genes. Okay. So what is it that we can control? We can control things like what goes into our mouths. We can control things like how much physical activity do we or do we not get. Our focus is on what is it that we can control, and more importantly, what is it that we need to control. Next. There are a lot more of these opportunities than you realize. Now we're in the Christmas season right now, but all of the kinds of things that come up during the Christmas season that characterize the quote holiday periods, when things can get disrupted, your schedules can get all out of whack, you start being presented with opportunities for more food, more drink, and all of that kind of stuff than normal. Think about it. You got things like Valentine's Day, Father's Day, graduations, the other high holy days. I come from Mobile, Alabama, where we have Mardi Gras. That's a full 2 weeks of celebration. You have Easter, Founders Day, 4th of July, weddings, all kinds of. There are lots of periods where your chronic disease management approach can be disrupted by these holiday periods. And we have to put in place the same kinds of reactions and behavioral changes that we're talking about now. Next. So, holidays are to be taken seriously. It's a time when we shouldn't be fearful of having a good time. We want to share time with family and loved ones. We want to become spiritually connected. Let's not forget the reason for the season, especially in times like this, Christmas time. Sure, it's important to shop, to decorate the house, wrap gifts, to bake and cook. But of course, big problem with some of this stuff is that we eat, eat, eat. Next. Now, the kinds of things that can go wrong, the stuff that we're trying to avoid, cardiac events. You've heard already Dr. Reynolds talking about the heart attacks and strokes. Big risk for these kinds of things during this time period. What we don't hear as much about, especially in situations where weather can get wonky, falls, weather-related injuries, and even when people are doing things like decorating, they're climbing up on ladders, they're doing things that they normally would not do, okay? And then I'm gonna invite the other speakers to talk about other things that can happen that are unusual during the holidays that can put you at risk in ways that you aren't normally at risk. Respiratory flare-ups, okay? Listen, I was at a meeting 2 weeks ago. 30,000 people were at that meeting, large crowds. I met a lot of people, saw folks that I had not seen from different parts of the world. And, and the problem was I came back from there with one of the worst respiratory problems. My sinuses were all congested. My chest was congested. And, the fact is that we have to be careful about folks coughing. Make sure we wash our hands more regularly. Wear masks. Just because we're not in COVID doesn't mean that mask wearing doesn't continue to be important. And when you're in big crowds and you're around folks that you don't know, and people are sneezing and wheezing and coughing, beware of large crowds because there are risks and there are viruses out there now that we haven't even characterized well yet. Okay. Medication errors, lapses in taking medications. Don't forget your medications, okay? When you're going out and about and you're running around, put them in a place where you can be reminded of the fact that you need to have them and you need to take them on schedule. Overindulgence of a wide variety of foods causing increased problems with blood sugar levels, blood pressures, blood fats, lipids, and we'll talk a little bit more about this at the end, low blood sugar reactions, hypoglycemia, and then of course, high blood sugar reactions, diabetic ketoacidosis, which you see in type 1 diabetes, and this is HNKC, hyperosmolar non-ketotic coma, type 2 diabetes, where people can get blood sugars in the 5, 6, 700s. These are big problems that we need to be aware of and be taught to avoid and be on the alert for, because some of these, particularly hyperosmolar coma, you may not even have any symptoms. DKA, you will have symptoms, but 95% of the diabetes that we deal with is type 2, okay? Exercise care and caution in nutrition and your approach to nutrition, and Dr. Morrison is going to highlight that. Remember that you got to keep moving and moving purposefully. And Justin will give you clues and hints about that. Next.
Dr. Gavin, can I say one thing if you don't mind?
Yes, please.
Yeah. In terms of emergency medicine, I know we have Dr. Wanda Ramsey. She's been a colleague of mine for over 40 years now, but she's the ER doc as well. And one of the things we want to let people know, especially those that are type 1 diabetes, although it's been documented that certainly people with type 2 can also get DK as well. But the big thing is that you smell them. I did a little skit about maybe a month and a half ago on diabetic ketoacidosis, and I was play acting basically, and you smell. It smells like finger polish remover.
Acetone.
Acetone. I mean, it's really strong. Those patients, by the way, Dr. Gavin, and I'm sure you know, but the others may not know. I'm sure Dr. Ramsey knows, as well as other doctors that's on. Those patients typically, you come in with DKA, you bought yourself a ticket to the ICU because it is a complex way in which you have to manage that. Sugars may not be super high, but I got to tell you, your ketone levels are up. You're in metabolic acidosis. That's the worst thing that you can be in, by the way. So we have to try to balance that out. So be sure that you follow the instructions of hopefully your endocrinologist, if not a very good internist, that's managing your blood sugars. This is a very critical time that we normally see a spike in that.
Let me make one other point, Dr. Reynolds, that you remind me of, because typically type 2 diabetes is very unusual to have diabetic ketoacidosis, but there is now a circumstance, there's a medication, that's the SGLT2 inhibitors that are being used in people with type 2 diabetes that actually can predispose a person who has type 2 diabetes to actually having DKA. And your DKA can occur at a time when your blood sugar can be less than 200. So this is always something to be mindful of. And that's why I say, when it's an important time to ask about, are there things that I need to be careful about during the holidays in particular, since I have this certain condition that I'm dealing with, okay? So very important to keep on top of that. And these are kinds of things that we're going to be coming back to from time to time, because we want you to be totally and completely familiar with them. But now we're going to segue to nutrition.
Yeah, and listen, guys, don't underestimate what Dr. Gavin talked about, hypoglycemia. In the emergency department, these are really emergency, big time for sure too. If you don't treat these people fairly quickly, they may leave the earth. Okay, simple as that. And it's a simple thing. If you're on insulin, your doctor should make sure that you have a glucagon pen. It's like an emergency pen. You just stab yourself in the muscle with it, and you're fine. But it's very important to make sure that you guys understand that the signs and symptoms of hypoglycemia can be very scary. People have seizures, they have chest pain, they look almost like a heart attack for sure. They sweat, they're in trouble. I'll leave it at that. Thanks, Dr. Gavin.
And we're going to come back to hypoglycemia in a little bit, because we're going to talk about that in connection with alcohol in particular. But by the same token, I want to make sure that people know, if you have questions, please feel free to either put them in the chat or interrupt, because remember, this is a helpful hints kind of session. And if you have things that come up to you, please interrupt and ask. Okay, Dr. Morris.
Good morning, everyone. Thank you again, Dr. Gavin, Dr. Reynolds, everyone that's in attendance. Thank you for your attendance this morning. Like Dr. Gavin mentioned, we do want to empower with knowledge. The Bible says, if it costs you everything, get wisdom, knowledge, and understanding. And my people do perish for lack of knowledge. So next slide, please. With the holiday tips, we want to speak on a little bit on, next slide, please, meal spacing. I know we just came out of Thanksgiving, and I know we were house hopping, but I do want to emphasize the importance of meal spacing. And the reason why I want to communicate that is because we may be overeating too quickly back to back. I could just share, I was invited to my husband and I were invited to quite a few homes, and it was food everywhere. But like it's already been mentioned, you always have to be strategic. So even spacing out your meals and snacks throughout the day will help keep your blood glucose levels stable. The general guidelines say to wait at least 2 hours, but no more than 5 hours between meals and snacks during the day. And it takes about that time for full digestion. For the moment you chew your food, that's the first phase of digestion, and then it goes down to a normal process of going through the stomach, then the intestines, then exit out the anus. So what I suggest is, if you're going to decide to stick with your meal plan is already built in where you're spacing your meals. Breakfast a couple of hours is a fast. Lunch a couple of hours is another break in time, and then dinner. Sometimes we're not mindful. We'll be in an environment where we're sampling, we're nibbling, and that is also considered consumption, and it counts. Your body and your organ goes to work. It starts to break down those foods. So just be mindful. Even if you perceive a portion of a plate as not a meal, honestly, everyone should be having a pediatric size plate. When you start looking at the adult size plates, and then, the serving of food, to keep you in better control, a pediatrics or a kid size plate will help you control your meals better, because you can't fit all that food on a pediatric plate. Um, Also, the going back for the second plate of food and the third plate of food, so that food was so good. Your body will pay a price, a consequence. So in addition to spacing out your food, that's related to one plate of food. That is not that is not you have 2, 3 plates of food at 11, and you're going to space it out to 3 because it's time to eat again. No, it's not. Actually, you're done for the day, and you should not really be eating that heavy in one sitting anyway. You're overwhelming your organs to do a lot of work at that point in time. Your goal is to not eat till you're full. Your goal is to eat till you're content. So you shouldn't have the itis. You shouldn't be unloosening your pants buckle or a buckle of your belt, and you really should be seated. You should really take a walk after that meal. So it's a lot to consider. New practices and new lifestyle habits, like Dr. Gavin, Dr. Reynolds were talking about, because currently it's a no holds barred. There's no boundaries. Hey, it's holiday. What you making? You making sweet potato pie? I'm gonna taste that. I'm gonna taste your banana pudding. I'm gonna taste your red velvet. Oh, you're gonna eat all those desserts on top of eating a whole plate of food, and you eat another plate of food 30 minutes later. So where all this food's gonna go? Are you gonna go play basketball for 2 hours? Like, where all this food's gonna go? So when we say, space out your meals, that's on one plate of food. That is not, you thought 3 plates and you're done, so you should take a break. No. Next slide, please. Um, in addition to spacing of the meals, what to really expect around the holidays. What do we expect? We expect discipline. We expect um, obedience. This is a lifelong type of change, and we're going to request, after we talk about the holidays, that you move forward and apply these principles every day. Eating is the main focus, but it shouldn't be the only focus. I know we are consumed during the holidays with food. That's how we fellowship. That's how we connect with others. But it shouldn't be the only focus. When you sit down in fellowship, say grace, and eat, okay, after about a good 20 to 30 minutes, it does not take 2 hours to eat. It just doesn't. What are we going to do with the food we eat? Carbs. Be mindful of your carbs. In this slide, I gave a few choices. Breads, traditional breads, but cornbread as well. Roast stuffing, those are our carbs, those are all fuel. Potatoes of all form, sweet potatoes, corn peas, milk, fruit, candy. And if you don't eat candy during the holidays, the sweets, the desserts, the soda, the sweet tea, the juices. You have your physical carbs and you have your liquid carbs. And again, your body can maintain, and then it can go into, it can be punished. You're punishing your body, your organs, when you're just over consuming with carbs, and then you're drinking your liquid carbs, and your stomach will stretch. It would accommodate the food, and your intestine will break down the food, and hopefully your poor pancreas will be like, okay, that's enough already. But then because we don't understand the nature of our bodies, we injure it again at dinner, and then we're not done because we're up to 2 in the morning. So we're going to injure it again, a mid morning snack because it's the holidays. I mean, the indulgence and the gluttony, it has no limit. So we have to be very mindful, and we are going to ask you to count what you eat in a mental way. You're not going to go pull out a calculator and go in the corner and calculate. No, but you're going to visually eyeball and say, you know what? That's enough. You can stop serving. Many times when I get served, I have to say that's enough. Or if I say, just want a small portion, everyone's understanding of small is not small. It's a big, deep heap, scoop of no, no, no. Take half of that off. I don't want to be wasteful and throw the food away. But when you're indicating control, you have to help others help you stay in control. Especially if someone's serving you or making a plate for you, you'll understand there is no understanding of portions. We just eat. We just eat. We pick what we like. We eat what we like, and we're trying to undo centuries of that. We're really trying. Okay, everyone all around you is eating, so it's of course no one's gonna get on you. No one's gonna chastise you because that's the environment, that's the culture. But you're eating strategic. You're eating with the purpose. Like Tom Jones used to say, "A party with a purpose." We're eating with the purpose. Peer pressure to eat. Here you go, have another slice of pie. I made this, test it. Tell me how it tastes. Finding comfort in your favorite foods. Again, it's an opportunity, holidays, for you to just relax a little and relax and enjoy. And no one's gonna be, hounding you. No doctor's gonna be, putting pressure on you. But they are, because ultimately, when you get back to that doctor's visit, it's gonna tell a story. And we want good reports. We want good reports. We want improvement. We want stability. And with where we are right now in this country, there is no reason why we can't get that outcome. But we understand we do have to be intentional in educating. In education and reinforcement, some of it may seem, oh, they talked about that already. We understand people don't really make an action until you kind of be repetitive. So when we're talking about food, it's even more of a repetition, because food is culture, food is identity, food is comfort, food is something that we all seem to feel like we can control. But ultimately, if we don't control what we're eating, the food will control us. Next slide, please. So with the carbohydrate counting versus your choices, just to show you, you don't have to necessarily be diabetic to follow a carb counting system, because your body is going to get the fuel it needs. It's going to absorb what it needs. And we want you to not even get diagnosed with diabetes. That's the ultimate goal. For example, a cup of mashed potato. A cup of mashed potatoes is 36 grams of carbohydrate. Keep in mind, one serving of carbohydrate is 15 grams. So when you serve yourself half a cup, get half a cup, put potatoes in it, and put it on your plate, and visually keep a mindful eye on, this is half a cup of potatoes. When you go out to dine out, you already know, oh, they've already serving me 2 cups of potatoes. I'm gonna have to tell the waiter, I would like smaller portions. And you can do that. When you dine out, you are in the driver's seat. You can communicate, especially carbs, what you would like to be served. Not to be wasteful, but can you give me a smaller portion of whatever you're serving related to carbs? As you notice, if you notice, the asparagus is 8 grams. Is 8 grams. If you notice that it's not heavy in carbs, and we're going to talk about what's free food, that is no pressure, no worries. If you also notice the dinner roll, that's another serving of carb. Okay, the chicken is 0, because we know protein has no carbs. We know animal sources have protein in it. So we do lean a little bit more as far as your plate composition for the meat to be a little bit more. The pear, the small pear, as you can see, is a little bit more than one serving. One serving of carbohydrate is 15 grams, and the margin is 0. So your fats, your protein, dark green leafy veggies have 0 grams of carbs. Keep that number in your head. 15 grams is one serving of carb. 15 grams. And one serving is not something we're used to. When you make your mashed potatoes or your garlic mashed potatoes, and you put your cream and you put your butter and you serve yourself, I know it's not half a cup. I know it's almost 2 cups. I know it. Next slide, please. So these are the carbohydrate
Dr.
exchanges.
Morrison, if I could just add one quick thing, because obviously dining out is a time when people can, they serve you portions, as you mentioned, your portion sizes are twice what you ought to be eating. I just want to just remind people that a safety valve is called the takeout box, the take-home box. You don't necessarily need to turn the food back, but you know what? They're serving you enough for another meal. That next meal can be the next day, and that's a way to make sure that you stay within the boundaries that you're hearing about right now.
Agreed. And then, so I wanted you to, I said one carbohydrate choice is 15 grams of carbohydrate. And what is a carbohydrate? Starch, that's 15 grams. When you guys went to school and they gave you that one carton of milk, that's 8 ounces of milk, that's 15 grams. When you eat that very small apple, that's 15 grams. So in the body, the carbohydrate is equivalent. So if you choose to have a slice of bread, a cup of milk, or a piece of fruit, it equals the same amount of carbs in the body. And a lot of people don't understand that. They just harping on, oh, rice is a carb. Oh, but also too, a small orange juice, but also too a cup of milk is. So if you wanted to move your carbs around, know that the starches also are not just the only carbohydrate source. Milk, that's another category, and fruit. So we know the carbohydrate categories are fruit, milk, and starch. And if you look at the vegetables, 15 grams will equal 3 servings. 3 servings of vegetables literally like a decent sized salad, because veggies are low in carbs. Next slide, please. So I just wanted to show a sample meal. It may not reflect a traditional cultural meal entree, but for example, we know that 1 serving of carbohydrate is 15 grams. A medium sweet potato is 30 grams. Okay. The margarine, like I said, fat is 0. We said a cup of milk is 15, whether it's skim, low fat, or whole milk. However, if you look at the rest that are 0, and what we said, the protein, the animal, the chicken breast has no carbs, is 0. The dark green leafy vegetables, broccoli, is 0. The salad, arugula, spring leaves, is 0. The low-fat dressing, 2 tablespoons, is 0. So out of this whole dinner, you've only consumed 45 grams of carbs, or 3 carbohydrate servings. That's literally equivalent to like 3 slices of bread. Your body could use that just for maintenance, just for a homeostasis component of, making sure your body works well. It's not going to do any type of harm with that type of structure. And you can substitute the carbs. So if you didn't want to do sweet potato, you could do plain potato. If you didn't want to do chicken breast, you could do salmon. If you didn't want to do broccoli, you could do kale. You could substitute in the same family group and still keep the carb intake under control. Keep in mind, the snack is not an hour later. The snack is a couple of hours later. And what is it? A small apple, which is another 15 grams, and the peanut butter is 0. Peanut butter gives protein and healthy fats. And again, your snack only gave you 15 grams. That's still doable. What we're probably doing right now with holiday meals, that 45 grams could be multiplied maybe 4 times more, because our portions are huge. That's why this sample menu is specific. 1 medium sweet potato. It didn't say add the brown sugar and the butter. We're not there at the pie yet. It says 1 cup of skim milk. It says 4 ounces of baked chicken breast without the skin. The portions are intentional. So when you look at your pediatric plate, it could fit that, the separate side plate for a salad. It could fit that. But if you have a huge adult plate and you decide you don't want just 1 piece of chicken, you want 2 pieces of chicken, even though it has no carbs, that's also something that we want to be mindful. Do you really need to consume 40, 50 grams of protein in 1 meal? Are you strength training? Are you preparing for a marathon? What is the goal? If it's normal sedentary lifestyle and we have not even begun to introduce exercise to our lifestyle yet, no, you don't need 2 pieces of meat, lunch and dinner. You don't. As far as I'm concerned, I would encourage you to lean more on the broccoli, lean more on the salad if you're still hungry. Maybe drink another glass of alkaline water. That can definitely cut that hunger without hurting your blood sugars. Next slide, please.
Okay, we also, guys, I'm sorry to interrupt Dr. Morrison, but we want to make sure that we have about 55 people that's online now. We had about 85 total. We wanted to make
Mhm.
sure that we begin to capture the information that we need to have. That is the post-test
Okay.
evaluation. These things are critical, guys, for us to maintain what we're doing. We need to know what you're learning from what the experience is. So please take a moment or two, even during this period of time here, to fill out the post evaluation, a post-test evaluation. All right, this is very critical. The other thing, Doc, we need to begin to wrap your part of it up, because Justin has to still give about another 5 or 6 minutes or so on the physical side of things. And we're going to open it up to the audience, because I'm sure they must have a lot of questions and a lot of chat going on here. So we need to address some of these questions, but I want them to personally ask those questions. I also want to take a personal liberty out to thank my good friend, Dr. Wanda Ramsey from Maryland. Sister Paula Reynolds, she's in DC. There's Dr. Candace Brown, she's in the Orlando area, if I recall correctly. There's a Dr. Wayne Minjo, who has a PhD. There's Lakeisha Bush from Michigan. There's also of course, Dr. Ms. Ann Gavin, Dr. Gavin's wife. There's a Danella Richard. If you never saw a program before, it's called Traveling with Danella. It's a very great program. Also have Mr. Jerry Butler, who is visiting us from the Bahamas. He's in the Bahamas right now. Kimmy Ingram. I love Kimmy. She works for the Department of Health. She just wanted to just come on and just see what we're saying probably. Then there's a Miss Tiffany Whitfield, operated on Tiffany Dick for yesterday, and she's doing well. She's here. I also want to thank Lisa Bennett. Miss Bennett, she is I want to say she is the chief of staff for Pastor Arthur Jackson III. That's it. Thank you so much, guys.
So what I was gonna say is with the free foods, where we saw in the previous slide with the 0 grams of carbs, this is more explaining that free foods. Dark green leafy vegetables, cruciferous vegetables, allium vegetables, and then we have given you some examples. Tomatoes are fruit, you guys. Tomatoes, peppers, squash, cucumbers, and then you have your beverages that don't have any sugars added. So basically, with the holiday, next slide, please. With the holiday plate model, basically it's very simple. You fill half your plate with vegetables or salad. You fill half your plate with vegetables or salad, followed by lean meat and a lower glycemic index carbohydrate. So if you can see on the left, this plate has 2 servings of protein and a big serving of starch, which is 870 calories. And on the right, they've reduced the starch, took off 1 serving of meat, and doubled the vegetables. Okay, next slide, please. So this is an example of the plate model. On the left is a serving of the mashed potatoes, the cup, that's 2 carbohydrates, your protein, and the half of the plate is salad. And then on the right, your carbohydrate sources are not as much, but you have your tomatoes, your carrots, your broccoli, and some small lettuce leaves, and a healthy serving of the protein source. And this is kind of how your entree should look. Even though you may have 7 different carb choices at the Thanksgiving table, 14 different meat choices, this is how your plate should look. And this is not even a pediatric plate. Okay, so remember, next slide, please. Monitor.
Doc, you just keep it real.
Uh,
Our Christmas plates, I can tell you the truth, is, at least in my family, don't necessarily look like that. You know what I mean?
I know, that's the
But
goal. That's the goal, but I
okay,
understand.
you got it.
um, yes. Remember the basics. Monitor your carbohydrate intake. Maintain consistency of routine. And I think when Dr. Gavin showed you all the holidays, you can have a one-off, but get back
Right.
on the horse.
There you go.
If you, to Dr. Reynolds' point, if you want the candy yams, you're gonna have to get just 2 pieces because it's soaked in a lot of sugar,
Mhm.
and you're going to get a smaller portion of the mashed potatoes. That's how you would do that. Increase monitoring your blood sugars, carb counting, and portion control is necessary. Exercise is a high priority. And again, don't drink alcohol on an empty stomach. But like Dr. Gavin said, we will talk more about that. And thank you again.
Thanks, Doc.
Mhm.
So Justin Reynolds, you can go ahead and you begin your presentation. I don't know if you have any slides or not. There we go.
I don't actually even need slides, but I will make do. How is everyone doing this afternoon? I would say it's morning, but it's afternoon. And if you are a University of Miami fan, try not to look at the screen right now because it's about to start. So I'm
Oh,
doing my best to do both. I know my dad is probably putting on the TV as we speak.
yeah.
Go you. All right, hopefully they win. Jesus, we need that. Anyways, how's everyone doing this afternoon? I am Justin Reynolds, and I am here to talk about a lot of different things. I'm gonna make it fast though. Hopefully I can do it in like 5 minutes because I know a lot of people have a lot of questions. Let's just get right into it. I want to talk about chronic pain. I have a few clients that have chronic pain. I have a few clients that have high blood pressure. I have a few clients that have diabetes. So we're gonna talk about chronic pain real quick, and then get on to high blood pressure real fast after that too. So with chronic pain, most people living with chronic pain can exercise safely. Physical activity can also help with pain management, whereas being inactive can lead to a cycle of more pain and loss of function. So it's important to remember to listen to your body when exercising and participating in physical activities. So we want to avoid over-exercising on good days. If you have pain or swelling or inflammation in specific areas, you may want to focus on other areas or rest a day or two. Now, for me, I don't really rest that much, but I am a little bit different as far as the fact that my job is to consistently help people pretty much every single day. So I'm pretty much in the gym every single day. But for those who have chronic pain, you're going to want to talk to your doctor about what exercises and activities that could be right for you. Also, if sometimes doctors might not know that much about exercises or activities, please try and find a trainer or someone that's professional in that aspect, such as myself as well, that can help you out on trying to get into the right training exercises and get on the train for that. High blood pressure. Physical activities can help older adults with high blood pressure, right? Reduce or even manage their blood pressure and lower the risk of blood pressure continuing to rise. It also helps protect against cardiovascular diseases, including heart disease, strokes. So also people with high blood pressure, moderate intensity activities for like 90 minutes a week can help to significantly lower the risk of heart disease. So more activity can lead to an even greater benefit. So what are these activities? Well, just an example, again, aerobics, muscle strengthening, like functional training, even bodybuilding, or even basic lifting activities that can also be beneficial. Now, again, when it comes down to these lifting activities, I'm not saying when I say bodybuilding, by the way, I'm not saying you're going to go out there and be the Hulk and go crazy. I'm actually saying that bodybuilding can still be a term of just getting some weights and just lifting them, right? It's literally just basic movements is pretty much what bodybuilding movements are. So I don't want people to think I want you to look like Ronnie Coleman, in his prime. That's not realistic. That's not what we're trying to get to. Obesity. It's another big one. I have a few clients that were, morbidly obese. I know I don't have the slides for that, but let's just say I've had people that were in the upper echelon of the high 200s and are now at the low, say like right at the high, like 190, 195. And they look amazing. And it took about 6 to 8 months, by the way. A lot of it has everything to do with mindset. So if you have the right mindset, everything kind of goes a little easier for you. So back to obesity. If you are overweight or have obesity, don't let that stop you from being physically active. So anything that gets you moving, even if it's only for a few minutes a day in the beginning, a healthy start. So slowly work up to more and more and more. If you have difficulty bending or moving easily or feel self-conscious, try different activities. So walking, water exercises, dancing, weightlifting to see what works best for you. So if you do have the funds, by the way, for a trainer, please do so. Please. Most people say they can't afford a trainer, by the way. But to be honest, let's be real. We spend way more money on stuff we don't need, and we push the things that we do need. So let's try and focus more on the things that we do need rather than those other things. You know what I'm talking about. I'm sure everybody in the back of this computer screen of mine knows that they've had a few things they did not need to buy. Okay. So kind of one of the things also I want to talk about before I go ahead and go for questions is Dr. Gavin was speaking earlier about type 2 diabetes and physical activity with type 2 diabetes. Physical activity with older adults that manage type 2 diabetes can stay healthier and live longer. It improves blood glucose levels. It can prevent and slow risk factors that contribute to diseases getting worse. It helps protect against the leading cause of death in type 2 diabetes, so cardiovascular diseases like heart disease and, again, stroke. So what is it that you want to do when it comes down to working out, right? What are the activities you could do? So you want to at least get in between that 120 to 150-minute mark a week of moderate intensity, like aerobic activities or muscle strength activities, if that sounds familiar, like I just said before. So I always tell my clients, you want to like set a goal. So setting a goal to be active most days of the week, create a plan that fits best for you and your life. Your healthcare team can help you. People exercising with diabetes must especially be careful about monitoring their blood glucose levels. So choose appropriate footwear. I know my dad will basically say something like that too. You want to avoid injuries to your feet, especially to your feet. And that's basically about it. I know that my whole entire purpose of being on this Zoom was to make sure that everyone that knows it's not too late to go to a gym. It's not too late to go for a walk. It's not too late to go to the mall. And I know it's shopping season. It's, it's the holidays. So use that as an excuse to just walk around the mall. Get some kind of active or activities going for you so that you can potentially live longer and feel better.
Justin, thanks so much. I want to just start the questioning by asking a very practical thing because it's the holiday season. And you just mentioned at the start of your comments that in a few minutes, a lot of folks are going to be spending 3 hours in front of the TV watching the U of M do battle. And they're going to be watching other games like they did last night with OU and Alabama.
Exactly.
What kinds of things, when people are going to be trapped by a screen for 3 to 4 hours, what kinds of things might be helpful to just get some kind of motion in, because something is better than nothing, right?
So I was gonna say, what's kind of funny about TVs in this generation? We're in the year, 2025, about to be 2026. My God, that's going by quick, by the way. We have things like this, phones, right? A lot of people, including my dad, we can watch games on our phones all the time. Whether you have YouTube TV, whatever you have, you can watch it on your phone, which means you can go anywhere. You can watch it on your phone. You could be on a treadmill. You can be on a nice little walk, whatever it is. Don't drive and do it, by the way, because that's cheating anyways, and that's deadly. But I would rather you go ahead, have it on your phone, walk a nice little mile. Guess what? To be honest with you, a lot of people, whenever they're at the gym, right, and I see them at the gym, they're on their, the techno gym, what do you call it, like Stairmasters and stuff like that. They always have this little thing in front of them, watching a movie, right? The time goes by faster when that's happening. It's entertaining. So technically speaking, it actually is a cheat code, but it actually works. A lot of people find that to be something where they're not even thinking of the exercise. They're doing the exercise. They're still moving. They're still walking or on the treadmill or on the elliptical, whatever it is, but they have this little device that helps them out while they're doing it. So my answer to that would be, if you don't want to sit down and just be stagnant at home watching the television for a few hours, put it on your phone, go outside and walk.
I think Dr. Gavin was also mentioning that basically, like me, for instance, I can be watching the games, because I have like multiple screens, right? But I think what Dr. Gavin is getting at is, what can you do sitting down? There's some things you can do, moving, pumping your legs. There's other things you can be doing, moving your arms. You can do a lot of things that you're watching the TV.
I mean, again, if you're sitting down, then stand up, walk around. Even if it's in the house, go to the kitchen, go right back up the stairs if you have stairs, or just keep walking, and then come back down. Hey, especially we're big sports goers in this household. And there's one thing I can tell you, if it's a big game, I'm not sitting down. I'm standing up the whole entire time when I'm watching the game, right? If I'm watching the Miami Heat play, I'm standing up the whole entire time, hoping to God Tyler Hero can do something. I am up and standing. But for the people who are not as active as I am, I would just say try and practice sitting up and sitting up and sitting down, sitting up and standing and sitting down. Like, it's that basic of a movement, which is a squat, right, which can help.
And I see that the passive football he is on, and Unfortunately, he is a Dolph fan for sure, a big time Dolph fan. I feel sorry for him as I look at him right now through the screen here. Amen. And I just know that he had a rough time this year. I'm not sure how much exercise he got in. Maybe he's throwing some few things, what he was doing, but brother, I feel you. I pray for you. I'm glad that
Well,
Pastor Johnson is still on.
I'm also a University of Miami fan,
Oh,
and my wife is a strong Alabamian. So I say that to say there's 35 push-ups today, Justin, because I'm old school, Reynolds, Gavin. Every time my team scores for that exercise, I'll do push-ups. I'll do 7 push-ups. I know everybody can't do push-ups, but Justin, stand up, sit down 7 times, those type thing. Celebrate your team by burning some fat.
Yeah,
That's
this
it.
is extremely important to do these little accommodations because remember, let's not forget dancing. You know,
yeah.
I'm still working on where the fans at. You know, I'm still working on. I mean, listen, all of these kinds of things are helpful. 2 weeks ago, I did a 5K as an 80-year-old guy. I think I was the oldest guy in the race, but I finished and I left some of those youngins in my wake. So let's make sure we keep moving.
And let me say something to the age thing, right? Dr. Gavin, I've never told his age. He says 80 years old, okay? But Doc Reynolds over here is 74, okay? We older guys, as long as we keep it moving, keep our weight under control, we do pretty good for ourselves. Amen to that. And again, I'm so glad that Pastor Johnson's still on. This is incredible stuff. So listen, guys, I think Fred put in the chat somewhere about doing the post test. Fred, can you explain that? If you're still there, can you explain what they have to do to do that post test while they're engaged in this conversation? I know it was posted. I'm not sure
Yeah.
if you guys saw that.
Yes, this is they are re-added, but yes, it's simply once you click on that link, and y'all hear me okay?
Yeah.
Okay, yeah. Once you click on that link, everybody, it will send you to the post test. It's a simple 10 to 12 questionnaire, basically to go over the topics of what was discussed today, to see how much you retained and just to see how well we're doing. The purpose of this is to be able to continue to help and build the community with different information that shows us that what we're giving is actually helping you all out. So it's a simple form. It also allows you to add your comments at the end. Feel free to do that. It should take you no more than 2 minutes, and we thank you so very much.
Yeah, and then you also, guys, will be receiving a video, I should say a recording of this entire webinar as we've done with all of our webinars. I think it's on our site now. It's on YouTube, but TV as well. And Fred, make sure these things are uploaded so you guys can see those too.
Yes,
All right, so
remember, we still have a few last slides that we need to finish.
Oh, did we? Okay,
at
go
the
ahead.
end.
Go ahead.
Yeah.
Dr. Gavin, I apologize. I did want to say something, and then we finish. Dr. Gavin, Dr. Reynolds, Justin, and Dr. Morrison. It's becoming a habit. Everybody knows me, you guys, but not so. We do have new people on, Dr. Gavin, Dr. Reynolds, Pastor Eddie Jarvis. I have never seen him. A few new people. We have so I know you guys are modest and humble, but I do want the audience to know that we have the best of the best sharing this information for a little bit of nothing. And as African Americans, we don't get this every day. Appreciate that. Thank you
I
so
appreciate
much.
your comments. Okay, Dr. Gavin, then Dr. Gavin gets finished.
Let's sprint to the end because I know there are a lot of questions
We're gonna get to
and
questions.
comments that we want to get.
Okay, give me one moment. I'll reshare the screen.
I cannot wait to see Dr. Constance Brown. She is really some kind of person. And I've had her polo shirt and had her lab jacket for quite some time now. So it'll be a very happy moment for me to put that on her. That'd be great.
We just fast forward to the point past Justin's physical activity portion.
You go down with something like that. Things like maybe slide 20 something. Keep going.
It may be
It's much further down.
Keep going. And we'll move through this quickly because I think many of these points will already have been made. Go back. Go back. Back. Okay, so go back one more, because what I want to make sure is that you understand why it is we tell you don't drink alcohol on empty stomachs. Okay, we try not to tell you about a lot of thou shalt nots, but we try to tell you the how thou shalt do it and do it safely. That's really the key. Okay, if you're going to be drinking wine or spirits, do it with diet mixers instead of all of these heavily sweetened things. And if you are drinking these holiday themed drinks where you don't even know what's in them, what is likely to be in them is a lot of sugar. Okay, and make sure whatever you do, you're going to be drinking with a meal. Okay, next slide. The risk here is with hypoglycemia. When you're drinking, alcohol has a lot of different issues that it can raise. It can reduce the ability of your liver to make glucose when your food intake is low. That's why you really need to be making sure that you're eating if you're going to be taking in alcohol. It can increase insulin secretion and bring your blood sugar down if you're on certain kinds of medications. Alcohol-related low blood sugar or hypoglycemia is especially risky if alcohol is taken on an empty stomach, okay? And people who have a history of alcohol abuse, you know, I had a lot of uncles that used to be a little bit loose with what they did with the bottle, but that's a different story. This is a problem, okay? Because those kinds of folks that come into the holidays with a history of alcohol abuse, they're at high risk for low blood sugar reactions. And as you heard earlier, next slide, this is dangerous. Why? Because low levels of glucose actually can deprive your brain of the only fuel that your brain really can use effectively. And when your brain doesn't get fuel, nerve cells die. And when nerve cells die, you lose a lot of functions, whether it's cognitive function, the ability to move and operate your limbs. And now it means that you need to know how to treat hypoglycemia. First thing is to check the blood glucose. You need to know when somebody's acting wonky, they're slurring, they're not having a stroke, okay? They're confused, they're slurring their words, they can't make out things clearly. Check their blood sugar, okay? And then if the blood sugar is low, that is less than 70, okay? Give them either some candy, some glucose tablets. Make sure they can swallow, because one of the problems is that people who have low blood sugar can have problems swallowing, and you don't want them to aspirate and get into even deeper trouble. Okay, so there are things that you can give them that basically approximate about 15 grams of glucose. And we're talking about the things that you're seeing listed here. Wait 15 minutes, okay? Make sure they're under observation. Don't leave them, okay? And then check the blood glucose again. So that means you got to have a way of checking the blood glucose, okay? And then see whether or not that blood glucose has been raised to above 70. Okay, if it's still below 70, do it again. Do the 15 grams of carbohydrate or 15 grams of glucose again. Okay, next slide. Okay. Now, if it's really low, we're talking about less than 50, you need to be calling some help in. You need to either give a glucagon injection, and somebody needs to know how to use a glucagon kit. Okay, or you need to call for help. Okay. And remember the caveat that I pointed out earlier. The holidays are not a time when the response systems are always, at their sharpest. They're not the time when a lot of offices are closed, a lot of clinics are not, fully staffed. So you need to be especially careful here. So this is why you have to also do things like preventive measures, drinking plenty of water. Water is one of the best things in the world for you. No calories, hydrates you, helps to flush out excess sugar in your body, fills you up, dampens your hunger, and sometimes thirst can be mistaken for hunger. And so try first some water, and that may take the edge off. Next slide. Next. I'm trying to do one word pushes. Next. I'll do 2 words. Next slide. Okay, monitoring, okay? If you have diabetes, and we come back to diabetes because diabetes is such a flagship disease, well, now you're running ahead. Okay, that it's important to know that what your blood sugar is, okay? And the likelihood is that you're not gonna be interested in pricking your finger. Okay, and a lot of times people don't carry the paraphernalia with them for pricking their finger. One of the reasons why we constantly bring up these new technologies, wearing a glucose monitor, a little device that tells you what your blood sugar is at every minute, is because you don't have to prick your finger. Okay, that you can read it on your phone, you can read it on your sensor, the reader that comes with the little glucose monitor. And this helps you to make adjustments. It helps you to either eat less, take more medication, or to do other kinds of things that will be consistent with staying in a healthy range. Next. Okay, there are times when you want to know what the effect is of something on your blood sugar, something that you ate, something that you drank. The only way you know that is you need to be able to accurately measure what your blood sugar is. And you want to try to do this if you're in a family gathering or social gathering. You want to do this in a way that doesn't, cause a whole lot of concern or people to be uncomfortable. That's why we are constantly pushing these newer technologies that will allow you to get this information without the discomfort of, holding up a device and jabbing this and jabbing that. There are ways now that we're moving to try to get the information that we need so we can act on it in a way that's comfortable but accurate and keeps you in a healthier disposition. Next one. Okay, I'm not going to go through all of this. We've talked about glucose meters over and over again. Keep going. Keep going. These new tools tell you where the problem is. Okay, this is where we want to get to the end. A final cautionary note. The frequency of acute emergencies goes up during periods like holidays. So does the demand for responses to those emergencies. So does the demand for services to take care of these issues as they come up. ER services and acute care services may be strained depending on the situation that you have. And as you've heard, our healthcare system now is coming increasingly under assault. So we can anticipate that, especially for our communities, these services may become even more strained. Many healthcare provider offices during holiday periods in particular are closed. And now, given what's happening in some rural areas in particular, even in the non-holiday periods, we're going to be finding offices and clinics closing, hospitals closing. So, and then even people who are on duty during periods like holidays, they don't want to be. Do you think that they're enthusiastically sitting there waiting on you to call them and say that, you know what, I think I got a problem? You know what they want to say? They're probably saying that's your problem. But the full portfolio of medical services that you might need may not be fully available. So is this the setting in which you or your loved one would want to be in need of these services? No, no. So we want to make sure that you have as many of the tools that you need to prevent getting into a problem in the first place in order that you can stay safe and prevent problems.
Let me just also, Dr. Gavin, if you're 100% right on that. Being an ER physician for many years, I can tell you that when we have to work a holiday, especially Christmas, New Year's Eve, Thanksgiving, you're not going to typically get the best of the best ER docs covering that ER because it's just hard to find doctors to cover that. And then they're not going to be able to give you the care that you think you need to have, that you want to have, because guess what? There's a whole bunch of people out there in the waiting room waiting. It's like take a number. And the more urgent you are, the quicker you'll get back to the ER. If you come in by ambulance, you'll get in very quickly. But other than that, you're in the waiting room sometimes 6, 7, and 8 hours.
Yeah. And this is the last point to be made again. We're using diabetes, and Pastor Philpott made a very important point in the chat. We're talking about diabetes as only one of the chronic diseases that we're concerned about, okay? But the chronic diseases that we are dealing with, they don't take a vacation, even during the holidays, okay? Next, I think this is the last slide. Last one. Okay. And so if there are questions that you have or comments that you'd like to offer, this is a time. But there's one thing I would like to say before we get into that, and that is the next slide. And it is this, that we're going to be extending these kinds of discussions come next month when we talk about how do you know when you are at risk. You know, we've introduced this notion that your genes are important, but it's really your behaviors that really put you in harm's way a lot of time. Next month, we're going to be talking about how do you know when you're at risk for some of these chronic diseases? What are the signs? What are the symptoms? What are the measurements that you need to take? And what do you do about that? And CHP is going to be part of that conversation. So with that, we're going to go now and turn to comments, questions, if there are any.
Yes, fact, Dr. Gavin, just to piggyback on what you just said, the next webinar is actually January 10th from 11 to 12:30, and it's to deal with exactly what you just said. Webinar is to be discussing if you're at risk for cardiovascular disease and or diabetes. I'll be part of that, as well as Dr. Gavin, as also our cardiologist, Dr. Anthony Lewis. So we always want to have a spirited debate. Sometimes we debate ourselves, and it's kind of cool, I think, for people to see that, hey, we doctors have differing opinions also. So having said nothing else, hope you guys fill out those, the actual post tests. I know a number you have because I've already got texts from you, which is great. We really appreciate that. Now let's have some questions. And we still got 45 people waiting, so there must be some questions. Go ahead, guys.
And comments are welcome as well.
Yeah, comments are welcome too.
Eddie, are you still on? Pastor Eddie Jarvis, Dr. Mingo, are you guys still on?
Yes, sir, I am on.
Will you introduce yourself to our doctor team? And I want you to tell them your culture and your background and how did you hear about us? And of course, if you have questions.
Okay, I'm Pastor Eddie Jarvis, also a police chaplain for Miami Beach Police Department, and I also do a little bit of real estate on the side. My culture, Haitian background, born here, but my parents from Haiti and came here in the 70s. And definitely the church that I minister to have a diversity of Haitian, Jamaican, more Caribbean, and we got a couple Latinos and a couple Caucasians. And I heard of you from my good friend Willie, that goes to New Birth, Minister Willie. He sent the post to me, so I posted on our WhatsApp to encourage our people to join. And one of the reasons I joined too, because my dad, he's 86 and he's had diabetes type 2 for over 20 something years and still going. And they just discharged him this Tuesday from the hospital because his sugar level was 400. above 400. So I take special interest in that because, you know, I have my dad that suffered through that for years.
So much, man. You're going to meet Dr. Reynolds. He's in Coral Springs. I do want him to meet you. Pastor, Brother Mingo. Brother Mingo, are you still on?
Yes, Pastor, I'm still on.
It's Dr. Mingo. Yeah, go ahead.
Yeah. Yeah, but he's not a. Go ahead, Doc. Yeah, go ahead, Dr. Mingo.
Go ahead.
Introduce. I wanted Dr. Reynolds to be surprised of that, but I guess it's already tagged. Kind of introduce yourself. He is a member of New Bethel. That's not my point. I think what you have just accomplished, Dr. Reynolds, Dr. Gavin, there may be a way that you can just help us spread this message, Dr. Mingo.
Yes, thank you, Pastor Philpott. So my name is Wayne Mingo. I am a member of New Bethel. I have a PhD. My PhD is in health education and promotion. I do want to share the fact that when I went through the dissertation program process, my topic was about African American women and obesity. One thing that we kind of shy away from, but it's a fact and it's a reality. Our sisters have a problem with obesity, and I'm gonna throw this number out here, and it can be debatable, but the facts are the facts. 1 out of every 2 Black women are either obese or overweight. Okay,
Yes.
it's a fact. It's a fact, and what comes with that is a lot of the problems that you discuss: obesity, hypertension, cardiovascular diseases and stuff like that. So as one of the things that I would like to do is to help our sisters out. I think this program right here, this forum right here for your webinars are great because it's a matter of education. But I also want to take this time to talk about something I post. I'm making a recommendation for the readers that's on board. There's a book by this guy named James Clear. It's called Atomic Habits. And everything, I think the theme of every topic that was covered is behavior. This guy's book offers some real practical suggestions how we can change our behavior. And the topic of the book is called Atomic Habits. It's small habits, doing the small things to get to the long-term goal that we want. So I highly recommend that book for everyone. It's a bestseller. So, please buy it, go out and buy it. And I think you'll improve the processes. But also, thank you, gentlemen and ladies, for what you're doing. I think you're making a difference. And so I look forward to participating in future webinars with you.
If I could just point out that, thank you for that comment. And we have had in the past, and we will have again, specific focused webinars on obesity as a topic. Not only that, what the risks are that are involved with obesity, what some of the treatments are, old approaches, new approaches, behavioral changes that can occur, and then we try to point out resources that are available. So these are the kinds of things that we try to do on a cycling and recycling, because we can't do it all in one setting. We have to do this with re-exposure and new things always coming out. So very, very important points, and we will definitely be getting back to those kinds of topics again.
Dr. Mingo, let me say this about Pastor Philpott. Moderator Toby Philpott. He always give me information, seemed like last. All right. You should have been a part of what we've been doing from almost the inception of it. You embody the things that we need to have involved in it. You're evidence-based, I'm sure of that. PhDs are usually evidence-based. And we want to invite you to be a part of CHP's family. So we're going to really work on that with Pastor Philpott. Do you have any more surprises for me, Pastor Philpott?
Well, he didn't know. Well, no, to his defense, he really didn't know the topic of my dissertation.
Yeah.
And he's a great man. He's a man of Omega Sci-Fi. And so he's good. He's good to go.
I get all that, but you know what? If he didn't know, he should have known, because you are one of the sheep and he's your shepherd. Amen.
Dr. Ray,
Doc,
question?
hey, Dr. Gavin has taught me to stay focused, so I'm going to practice that.
Thank you, Pastor.
Listen, there's one thing I do want to say. Doc has highlighted it. An educated audience is the best audience. The pre-test, to all of you that are still with us, is critical. As Dr. Reynolds mentioned, these are dangerous times in health awareness and health services. So these dollars that we get to do this is based upon data. We need to do the pre-test. We need to do the post-test. Not only we discovered just a few days ago, we do not get full credit when we only register. We need to encourage persons to actually sign on and spend at least 30 minutes and get this information. And yes, you get the video. An educated audience is the best audience, and we do not want the state to take these dollars from our community. Thank you, Dr. Reynolds. Thank you, Dr. Gavin, Justin,
Dr. Ray,
guys.
I have a question.
Yes, Mr. Butler, go ahead. Jerry Butler, by the way, he is in the Bahamas. He's from the Bahamas. My Bahamian brother, go ahead.
Hi, Doc. Thanks. And Merry Christmas and Happy New Year and all that wonderful stuff to everyone from Nassau in the Bahamas. You guys in America, enjoy yourselves. And we'll enjoy our sun, our sand, and our good old Bahamian bush medicine. Keep going. But Doc, when I had signed up this time, I had sent you a question, and I hadn't seen it addressed, but I heard the doctor who was speaking about how we eat and diet. She was talking about the time difference between when you eat breakfast, lunch, and dinner.
Dr. Morrison, yes.
She used the word fasting, and she was intimating that fasting, basically gave your body a chance to recover from one meal to the next. Based on your advice, Dr. Reynolds, I flew over there, and for the first time in my life, I did a colonoscopy based on your advice. And I actually came over not to do it. They gave me some urgent medication to do it like within 10 hours. And I took the medication. It totally cleaned me out. So without going into detail, I didn't sleep for 8 hours straight. I went in, they did it, and I was really scared about the hokey pokey because never had it before. And when I woke up, it was like the guy just gave me excellent results and didn't find any polyps. Was beautiful. But the one thing I asked you about, Doctor, and yes, Doc, I will do it every 10 years like you told me I should be doing it. The one thing that came up was how good I felt once my body had cleared out. So I was asking you, is it recommended, Dr. Gavin, I guess, that you do a fast maybe once a week, once a month or something to clean yourself out? And if you do recommend it, are there any natural ingredients or something that the dietitian could tell me we should be taking if you do recommend? And if there isn't anything natural, do you have something clinical or whatever that you say that could be prescribed or over the counter? Because that stuff, Doc, that they gave me, in 8 hours, everything in me was gone. And I'm telling you, for like 2 or 3 days, I felt so good. I didn't even feel like eating a lot anymore. And I've got more pep in my step. And I can't wait for the next 10 years to do my next colonoscopy based on your advice, Dr. Reynolds.
Two things. And then I think that'll be a question for Dr. Morrison, and then maybe back to Dr. Gavin. Two things, though. One, I'm happy to hear that my good friend Jerry finally got his colonoscopy done, hadn't had one done. And how old, Jerry? About 56 years on him?
That's correct.
Yeah, he had not had one done. So I was concerned about that. And typically, guys, this is how it works. It's usually about every 5 years. I'm not sure what Jerry here, 10 years, usually about every 5 years. And if you happen to have polyps that they discovered that are benign, you'll come back 3 years later. Then if you get cleared for those polyps, then it's a 5-year program. So we don't want to catch colon cancer in its later stages. And colon cancer, by the way, is one of those slower growing cancers, by the way. So that means that you can go between 1 to 5 years and probably going to be in pretty good shape, even if they catch it, right? Midway. Now, the question, I guess, goes over to Dr. Morrison regarding his question. If you want to repeat that question to Dr. Morrison, you can, but I think she has it. Dr.
Yeah,
Morrison?
that's my daughter, Imani. I know you wrote that question. Thank you for the question. All foods fit. American Nutrition Association don't necessarily like to restrict any foods you would like to have for the holiday. What we do suggest is that you honor the portion control, like Dr. Reynolds was saying. Maybe the plate model doesn't necessarily resemble how we would like to eat, because we would like to eat more than one selection of carbohydrate choices. What I would suggest, instead of a cup of mashed potatoes, maybe do a fourth of mashed potatoes, maybe a fourth of the corn, and another fourth of another carb choice to equal a synonymous amount, which is 2 carbs per the meal.
Okay, that question was from Mr. Butler. It's not that question. Can you repeat that question for her, Jerry?
Okay, Dr. Morrison, I was asking, one, after that experience with the quick fasting and the clean out and the colonoscopy, was totally clean for me. He said they probably tell everybody that, but he said he'd never seen such a long intestine with no problems on it, etc., etc. But what I was asking was, do you recommend, or is there a recommendation that maybe once a week or once a month or something, you do a complete fast and take a clean out kind of diet? And if there is something that can clean you out, if you do recommend you do it, and how often you do it, is there something natural that you can take? And then lastly, if there isn't something natural, what they gave me was prescription, and it worked very fast, very well, and I have been feeling so good afterwards. Is there something maybe by prescription or over the counter that you recommend? So first, do you recommend a clean out kind of fast once a week or once a month? And second, what do you recommend that may be natural if you do suggest you do it? Or what do you recommend that you can get over the counter or by prescription?
You can get senna, you can get cascara sagrada, you can use chia powder or chia seeds. All these help move the bowels in a very deep way. Some do prune juice, some do magnesium citrate that will have the bowels to move. Ultimately, you want to do it naturally through a high fiber diet, so you naturally have bulky stools. That natural high fiber diet combines with cholesterol and makes the stools very thick and excrete it out the body. You definitely want to incorporate your whole grains on a regular basis. Your whole grain breads, your Ezekiel breads, your steel cut oatmeal. Throw a little chia powder in it to really bulk it up with fiber. Stay hydrated so you don't get constipated with a high fiber diet. Also, if you feel like you need a good washing out, you can, some people do senna. That's an ancient old type of thing where you could do senna leaves and boil it, make it a tea. You could do senna tablets. And I know when I had my time with long-term care, we use that for every one of our elderly patients, because we know the bowels slow down as you age. So everyone got that as needed. After about a day of no elimination, they got the senna. They eliminated really well. And so I just put that in the chat, 3 items. I can go into more with, little cheat sheets, but we do want you to, try to eat a decent amount of fiber, at least 25 or 30 grams a day if you can. I do suggest maybe the all brand cereal, which half a cup of that is 14 grams of fiber. You could do your fresh fruits and get some more that way. There are exceptionally high fiber foods that can keep you regular and also keep your weight stable. And then there's also your sennas, your magnesium citrates, your chia powders, your chia seeds, your cascara sagrada. Those type of things will help move your bowels as well. I too have a clean colonoscopy, but I'm very intentional in making sure elimination happens on a regular basis. Just speaking with some of the GI docs, they kind of tell you some of the polyps and stuff could be prevented. So, we don't want hemorrhoids. We don't want you straining to poop, but we definitely want the hydration on board. That's very important. Your GI gut requires a lot of fluids for functioning. And if you don't have enough sufficient hydration, you can be running the risk of dehydration or constipation. So I hope I answered your question.
You're muted, Dwight. Dwight, you're muted.
I have a question if it's still a time
Oh,
for
my other
more
daughter. Yes,
questions.
Mary.
We
Go
will be
ahead.
we will be
Hi,
able to talk. We will be able to talk coming up very soon
sorry.
on colon cancer and what you do to clean things out. What you had, by the way, Jay, most likely it's called Go Lightly. There's nothing lightly about going lightly because it goes heavy, okay? And what's in that is polyethylene glycol. It's a more of an osmotic diuretic. It forces the water into your colon and you begin to poop everything out to the point you'll end up pooping nothing but liquid, clear liquid. Doesn't mean your colon is clean, but it's called Go Lightly. And again, it's a polyethylene glycol 3350, if I recall correctly. Okay, sorry, go ahead.
Yes, thank you. I put in the chat because it's I know you guys are talking about healthier eating over the holidays and being in a moderation and not overdoing it because it tends to be that way and all the good foods are being made. But I didn't hear anything much about healthier alternatives for, and I probably missed it, but I just wanted to ask, like, for the classic dishes that we do every year, just around different families, like the rice and peas, or the mac and cheese, or the stews and the goats, if someone wanted to make it a healthier version, what could
So
be some options for them?
I'll give you a few suggestions. I know with collards, collards is a great source of dark green leafy, but we also like to do the ham hocks. You could do not a smoked meat, but a normal piece of meat to give it flavor. Um, some cultures deep fry their goat or their pork grill. Maybe you may want to not even sample that if that's something that can be altered. You could bake it, you could grill it, you could stew it. Some of the cultures, Jamaican culture likes rice and peas with coconut milk. You can also make that dish without the coconut milk. Wash the rice and limit your portion sizes when you serve yourself. Again, same thing with the mac and cheese. Some cultures use anywhere from 1 to 2 to 3 to 4 to 5, 6 cheeses, cream. Again, you could reduce that with the low fat cheese and, some type of low fat milk and reduce your portion size and also use a whole grain pasta instead of the refined elbow macaroni. Traditionally, when you look at stuffing, and you add the gizzards and you add the stock and everything that comes with that, it could be very rich. So again, you may want to be mindful of serving yourself a smaller portion, knowing that a lot of the carbs that we eat during the holiday season are very carb heavy, which means you use the pasta, that's one source of carb. Then we use the milk, that's another source of carb. And we're sometimes putting in, 3 and 4 carbs in one dish. So the portion has to be reduced. And you can also balance it. So if you have one traditional item, you could also offset that, like I said, with the salad, and don't go for the second and third and fourth carb choice on the same plate, and space out your meals. So if you did have a choice or desire to have the yams, and then you also want a mac and cheese, maybe have a smaller portion at lunch, the yams, and have a smaller portion of the mac and cheese at dinner. Not too late, nothing less than 1/4 of a cup. I know in the example I showed you a mashed potato of a cup, but when you start dealing with carbs that have 2 and 3 carbs in the dish, like a mac and cheese, you have the milk that makes the cheese, and then you add some more milk, and then you have the pasta. That's not a cup. That's more like 1/4 of a cup. So if you can't really alter the actual item itself, reduce the portion and spread out the spacing and take a hike or take a walk.
Okay, I'd like to also give out another special shout out to Dr. Mingo. I'm looking at his in the chat, I guess, and I just Googled Atomic Habits. Excellent book, excellent ratings by, looks like it's James Clear. And again, it's Atomic Habits, HABITS. Sister Paula, she wrote in the chat also I tend to walk around my house at least every hour while watching the games. And during halftime, I love my sister. I engage in dancing activities to help with my closing, my daily go, choosing my closing my daily goals. You guys put in a lot of really nice comments here in the. I'm not sure if you guys are looking at these chats, but looking at them from time to time, I got to tell you, this is some pretty enlightening stuff. Still have 40 people on at 12:56 is incredible. So if you guys, as long as you guys have questions, we're here to answer those questions.
I have a question.
Sure.
How you doing? My name is Jeremiah Ritchie. So we know around the holidays we are definitely going to, I would say, indulge and maybe overindulge. Is it something, or I want to say something? Is it I guess I'm thinking on the lines of including fiber in the middle of these meals that would kind of help, slow some stuff down and not make you eat so much. So I guess the question is, in a soul food meal, what is a good fiber item that you can add to it that will kind of make you eat less of the food that's not good for you and still help you on the fiber content, where your bowels are concerned, things of that nature that help you with cholesterol, while you're overindulging.
Thank you again.
Y'all let Dr. Gavin answer. We don't let Dr. Gavin answer that because.
Oh, okay, go ahead, Dr. Gavin. You got it.
Yeah, go ahead, Dr. Gavin.
No, I think that this again is where we really want to lean heavily on leafy vegetables. We want to lean into complex grains and stay away from the simples. Okay, and we've had, Dr. Morrison has really highlighted this in earlier webinars. And again, when you think about leafy vegetables, collards, kales, turnips, a variety of things of that nature. And if you can keep away from the saturated fats and those kinds of cuts of meat that are used as seasoning, now you get the best of both worlds. So that's why these kinds of suggestions are the kinds of things that we try to say over and over again, and then try to point you to alternative sources when we put these little tables up. Instead of this, do that. And even some of the YouTubes that we've done in the past, where we've indicated that do this and not that. Go back and you'll see those things highlighted. And the final thing I would point out, at the end of the day, portion control. Smaller portion sizes. Even if you do traditional methods of preparation, you stay on the safe side of the curve when you reduce portion sizes.
And don't go back for seconds or thirds. Dr. Gavin's words. All right.
I agree. That second and third, I third the motion. I would like to add, I don't know if we could add this, but is it possible that we can make a sweet potato? We can make yams without the brown sugar. Are we that disciplined that we could just enjoy the actual complex carb of a sweet potato without messing it up with the sugar?
No.
Then I could say enjoy and keep the skin on it. Then I can say enjoy the whole thing. But Dr. Reynolds said no, very quickly.
I didn't say no. I think it was Dr. Gavin. I didn't say
Dr. Gavin said no.
I think one of our audience members said no.
I said no.
Justin said no. Somebody said no.
That's one of my best desserts. So yeah.
Oh man.
Now, Justin, what I want you to say is, if you're going to do that with the brown sugar, I want you to add an extra mile. Okay.
Oh, you can do that too. You can do the extra mile. Go ahead.
There you go. It's all about balance. It's about, the yin and the yang.
By the way, I saw a question on there. Someone asked, when dealing with arthritic knees, if there was any alternative exercises that you can do daily. And there is. If you're going to do like low impact cardio, so like stationary bike, elliptical, swimming, rowing machines, stuff like that, those are always easy. Straight leg exercises, seated knee extensions, glute bridges. So yeah, there are things you can do. So I don't want you to think that you can't do certain things because you have problems in your knees.
Well, I'm on vacation time, y'all. And I'm afraid that my family members are hovering.
You mean Ann is?
Reminding
you
me.
mean the Queen? You mean the Queen is? I guess you guys have anything else, Dr. Gavin? You can go if you like, but if you have anything else, guys, you can go ahead and speak up.
So,
Happy holidays, everybody.
Thank you.
Yes,
I
thanks,
just
Dr.
wanted
Gavin.
to add, this is Paula.
Sister Paula, listen, Dr. Gavin, don't leave yet.
I just want to add that as a final reminder, everything that you can do is great, but the timing for when you eat these foods are also very important. I'm guilty of it, and I'm a registered nurse, and I tell my patients as well that, don't eat after 7 o'clock or after 8 o'clock. But I'm very guilty of doing that myself. So eating these foods and portion sizes and things of that nature is important, but when you eat it is also important.
Yes, thank you for that comment, Sister Paula. But the other thing, we don't talk enough about this, and we'll probably try to include this in future conversations, but intermittent fasting is something that can be very helpful to a whole lot of people. And we're talking about, they call it the 16-8 split, where you have a fasting period for 16 hours, and then in the next 8-hour window is when you eat, and you eat in a healthy way. Okay, so how does that work out? It means that you eat dinner today, but then you skip breakfast the next morning, and then you don't eat again until between noon and 8 o'clock p.m. the next day. Okay, and to do that on an intermittent basis can be extremely helpful, especially when you combine that with healthier food intake in those intermittent periods. So there are lots of techniques that can be used. Not everything fits for everybody, but there are ways in which we can structure these things so that people can do healthier behaviors that will align with their chronic disease management.
Okay.
Right.
Is there another question? Go ahead, Paula.
No, I was just agreeing. Agreeing.
Got it. Okay. Well, listen, guys, I think we're going to wrap up, but I want to thank my entire staff, especially those that are out there today. They did the health fair event. I was not there. They did the health fair event. It was very successful. Had hundreds of people there, and I'm always happy with that. And what's nice about that, guys, is that it was going along with Pastor Carol's annual toy giveaway for the people that do not have toys to give their children, right? So that's always good. So again, I want to say Merry Christmas, Happy New Year, Happy Holidays, and let's look towards a healthy and happy, prosperous New Year. And don't forget, CHP is on your side. We're here to help you. We're here to talk to you. And I got some experts here that's unbelievable experts. Dr. Gavin, Dr. Morrison, I guess I'm all right. A few other, Dr. Lewis, okay? We're all here, plus we're bringing in other people. Dr. Dallum, psychiatrist, she's going to be involved in a couple more coming up too, because we have to understand we're under a lot of pressure in the head, okay? If the head's not functioning properly, if the psych is not working like it should work, we got some problems too, even worse problems, right? So we're going to have Dr. Dallum on here within the next couple of months. We're going to have Dr. Morrison back as usual. The usual suspect, Dr. Gavin, always seemed to just come on in anyways, but he is, after all, our curriculum director. He said, well, what's up with me? He's our curriculum director. He handles all this stuff, right? And again, Fred, I apologize, man, because I was a guy that made the bonehead error by saying, I want to get my picture there, but I want to come in and pop one in at a time. He had it all set up. All set up. So only I have to take the blame for that. I'm a big boy, I can handle that. Okay, guys, anyone else have anything else to say? If not, we're good. And I want to have Pastor Philpott, if he's still here, he's still here, to give us a benediction and closing prayer.
Thank you, God, for every piece of information we've received today. I thank you for the gifts that you have given to our communities, people through Dr. Reynolds, Dr. Morrison, Dr. Gavin, Brother Justin. God, we thank you. We pray for a safe and enjoyable holiday, Christmas, New Year's, and all people in which they celebrate. We give you glory in our Savior's name, Jesus. Amen.
Amen. Happy
Okay,
holidays.
be blessed and stay safe. Stay